It's great to be here today, a chance to present a topic a little bit different than what's been presented so far. I realize those are much kind of bigger picture talks, and what I'll be doing is trying to really narrow in on a certain topic, calorie labeling, and talk about how some lessons that maybe we've learned there might give us some understanding of information provision more broadly. So I'm from the United States, and so I'm going to put this talk mostly in the context of American policy and things that are going on there, but like I say, I do think it is broadly applicable. And so when we think about questions of healthy eating, I don't think we're really talking about questions depicted in the pictures that I find when I do Google searches, right? We know that the apple is healthier than the 3 donuts and all those things. I don't think that's really like the question that's on our minds when we're talking about information provision, calorie labeling, things of that nature. What we're instead worried about are decisions like this. You're going into Panera, you're at a seminar like this, and people provide you with sandwiches. Well, what's the healthy option? Or how can I pick among these options that all have some health benefits, but also some health costs? How can we make those kinds of decisions? And we find out through surveys and through other measures that Americans, and I imagine other people as well, find these kinds of decisions really difficult. There's a survey measure that says 52% of Americans say they think it's easier to do their own taxes than to figure out what they should eat to be healthy. And this is important because a lot of these decisions are being made every day. 43% of food spending happens away from the home. And when people are asked to estimate calorie content of these meals made away from the home, they're not very good at doing it, right? They really seem to struggle at figuring out what the calorie content of these items is. So the typical response, I think, for most people is to say, well, let's give them information. And so this is a policy that's certainly in the works right now in the United States. First implemented in New York City in 2007 or 2008 is this idea of calorie posting on menus. I'll show you what I mean in a second. The Food and Drug Administration has announced nationwide calorie labeling will go into effect. It's supposed to be in December of this year. It probably will get delayed, but this is kind of coming. It's in the works in the US. And some companies, such as McDonald's, have already voluntarily posted these kinds of labels on their menus. So an example of this, here's from McDonald's, would be, there's the picture of the food. It's a bacon, egg, and cheese biscuit, and you can see the prices listed, and then calories. This numeric listing is going to be in the same font, directly adjacent to the price, makes it nice and clear what the calorie content of the item is. So that's what I'm talking about when talking about calorie labeling or numeric calorie posting, will be something like that. Unfortunately, there's a fair bit of literature that's looked at the effectiveness of these policies in places like New York City or other locations around the United States, and there's somewhat mixed evidence. So lab studies and hypothetical choice studies often find that calorie labels have a beneficial effect. People are choosing to order fewer calories, they're consuming fewer calories when they're in the lab. But when we move to the real world, when we're asking people to make these decisions in fast food restaurants, there usually isn't much of an effect found. So before labeling went into effect and after labeling went into effect, people are ordering the same number of calories from restaurants in New York City, for instance. There are a few exceptions to those real-world studies. So a couple nice studies done, one at Starbucks, another one at some sit-down restaurants. I'm going to return to those exceptions later on in the talk because I do think they're explanatory of maybe some limitations and some future directions of calorie labeling. So I want to present calorie labeling and information provision broadly under the auspices of a few guiding considerations. So here's one. Is the problem about information? I think this is really important. So in many situations, people, like those pictures I showed at the beginning, people aren't making these decisions to eat the donuts rather than the apple because they lack information. It's because they have a preference for the donuts over the apple, or they lack self-control. And so if that's the problem, then information won't necessarily really help. So we need to think about when we're providing information, when we're communicating nutrition information, safety information, is it really a lack of information, or is it a preference or a self-control thing that's driving the differences? So that's one consideration. A second consideration is whether the current lack of information is harmful. And this is a little bit counterintuitive, I think, but I'll use an example that I use in class. So I ask students, how many calories do you think are in a Big Mac? I'll let you think what you believe the calorie content of a Big Mac might be. It's a sandwich at McDonald's. And so most of them often will say like 800, 900, 1,000 calories, something like that. That's kind of the median response. And in reality, the calorie content of a Big Mac is 550 calories. So when people hear that information, when they get the accurate information, they go, oh, I can have the Big Mac. I can get the fries too. And that's not the direction that we want to be moving people's behavior by providing accurate information. And so in some situations, including some of those fast food environments I've already mentioned, giving accurate information might actually move people away from an inaccurate but beneficially biased prior belief. And so that's an important thing, I think, to be considering as well when we think about why calorie labeling maybe hasn't been so effective in some previous studies. What I'll be focusing on the most today is this third consideration. That's whether or not the information is usable. Can people make sense of and use the information provided? So we've had a number of studies where I've asked people, how many calories do you think you're supposed to have in a given day? And for some participants, they're going to say 10. Right? They don't have an understanding of what calories are as a meaningful unit, so they're just going to throw out some number. So if they see that it's 550 calories and they don't really know what a calorie is, it's not necessarily going to be that useful for those populations. So let's really think critically about the groups we're targeting and whether the information we're providing is going to be usable for those groups and in all settings. The fourth consideration I think is important to include. I won't really have much ability to address it in anything I'll describe today, but it's a question of the supply side. So how might firms and retailers react to information provision policies? So now that calorie labeling is going to be mandated on menus, are restaurants or other firms going to be embarrassed about including items that have really high calorie content? Right? Are they going to say, I don't want to have that on my menu? And are they going to reformulate their items or change the offerings that they provide in response to these labeling policies? And if so, that's a beneficial effect of these policies that maybe isn't reflected by consumer behavior. Okay. So talking about whether or not this information is usable leads me into a study I'm going to describe in a second. And in that study, we use traffic light labeling as one of our manipulations. I'm sure many of you are familiar with these kinds of labels, as I first found out about them from an introduction in the United Kingdom. And so these labels provide a green light if it's a relatively healthy level of a given nutrient, a yellow or orange light if it's kind of an intermediate amount, and a red light if it's an unhealthy amount. So for this particular frozen pizza, it has really high fat content and really low sugar content. So it got a red light for fat and a green light for sugar. It's good, probably, that pizza didn't have that much sugar. And so this is just kind of this intuitive, hopefully, graphical representation of whether you should avoid or pursue a given item if you're pursuing or avoiding certain nutrients. Okay. Some real-world studies have shown these to be effective at helping people make healthier decisions. One in a hospital cafeteria in Boston, another at a full-service restaurant in Oklahoma. They've found people moving away from red light items and toward green light items. So if we're comparing numeric and traffic light labels, as I'm about to do in a study I'll describe, we can think about how they provide different kinds of information and how those different kinds of information might be more or less usable depending on your goals and your ability to make sense of this information. So numeric labels are descriptive, they're exact, they're precise, they're telling you exactly how many calories are in a given item, but they don't really tell you what you should or shouldn't do about that. So if you know that 550 calories is more than you want to have at a given meal, then you can know to avoid that. But if you don't have kind of an overriding goal, that descriptive information maybe won't be as helpful or won't be as impactful on your decision making. Traffic light labels, on the other hand, are like inherently prescriptive. They're saying green light good, red light bad. And so they're giving you some guidance as far as what you should or shouldn't pursue. They're more categorical, they allow for easier interpretation, but they're also not as exact. There can be multiple items that are green lights. And so in that situation, it's not necessarily clear, just based on the light label itself, which of those items you should pick. So in our study, we're going to look at these kinds of labels in 4 conditions, a 2x2 design. So some people are going to see menus with no labels, some with numeric labels, some with traffic light labels, and some with both. You can imagine those that see both, maybe they see that 2 items are both green lights, and then the fact that there's numeric information allows them to pick the healthier between those 2 green lights. So maybe there's a real benefit of having both of these labels present at the same time. Just for interpretation of what I'll show you, here are the thresholds we used for the items in our menu. These are arbitrary, admittedly. Any study could choose to set different thresholds, but for our study, we set these calorie thresholds for what would be a green, yellow, and red light. So our study was done in an on-site cafeteria at a corporate headquarters in the United States. These people were employees of the company, and they were able to order online through a website that we developed their meal, and then they would go down to the cafeteria to pick up the meal that they ordered online. There was plenty of items for them to choose from. They got a discount for ordering through our website, and we were able to do this for 4 to 6 weeks, depending on the participants. So we could get multiple orders from some of these participants. So here's an example of what the menu looked like. You see this particular menu is in the numeric and light label condition, the combination. So they might see a smoked turkey sandwich, see that it's $5.95, see that it's 370 calories, and that receives a green light. So maybe they select that and move on with their ordering. Okay. So our results, we look at the total calories that people order to see the effectiveness of these labeling conditions. And what we find is that in the no labeling condition, people were ordering about 600 calories on average. That's not necessarily bad, but we're saying, can we achieve a reduction in the calories that people are ordering by presenting them with these labels? And sure enough, we find that with each of the labeling conditions, we saw a 60 to 70 calorie decrease in the calories that people ordered, which was great for us. This is kind of counter to a lot of those real-world studies that said there isn't an effect of calorie labeling. We are seeing an effect for these people ordering online through our website, but real meals. We wanted to go one step further, though, and really explore that question of, are labels usable, and for certain groups, yes or no? And really explore this idea that numeric labels require you to have some understanding of the numeric content, like the ability to use numbers, whereas traffic light labels are maybe more usable for people who aren't as comfortable with numbers. And so there's this measure called numeracy that just gets at your ability to use numbers, broadly speaking. And so we asked 3 numeracy questions, and we had the people that answered all 3 of those questions correctly, we called them high numeracy, and those people that made at least one mistake on these numeracy questions, we called them low numeracy. And so then we just looked at the results broken out by those groups, and we found that for those shown the numeric label, those with high numeracy scores were really affected, right? They ordered fewer calories, but those with low numeracy scores weren't really that affected by numeric labels. But when we switched to the traffic light labels, that's where the low numeracy group really changes their behavior. They really reduce the calories they're ordering. There's a slightly smaller effect for the high numeracy. And then when there's both the numeric and the light labels, it seems to be pretty effective for both groups, right? You're able to kind of, the low numeracy people are able to make sense of the light portion, the high numeracy people are able to make sense of the numeric portion, and you're seeing an effect there. So there really does seem to be a distinction between low and high numeracy groups in terms of their ability to use these different kinds of labels. And so if we really want to reach those low numeracy people, a numeric label alone maybe won't be sufficient, right? So conclusions from this study: when ordering meals online, we found that the labels do help consumers reduce the calorie content of their meals. And like I just showed you, that there was this distinction. Light labels help more for low numeracy participants. Numeric labels help more for high numeracy participants. Cool. So going back to this slide, looking at those exceptions, we can add a new exception to our list, this study that I just showed you. And now we can think we can really think about those exceptions to the rule and realize that most of the real-world studies described up here where there's null effects are fast food settings. Those are the McDonald's and the Subways of the world. And these exceptions are these different kinds of environments. Starbucks is usually going to be higher income participants or higher income consumers in general. And the reduction there is among the food calories that they're ordering. So this kind of decision that they're making on the spot. Sit-down restaurants, I think, also are probably going to be slightly higher income participants. And these are people that are going to have more time to make the decision. Online ordering, these people had plenty of time to make their decision. And sure enough, our employees in that sample were also high income. So I've mentioned income because that's going to be a thing we're going to pay attention to, is whether or not income is a potential driver of ability to use these labels. But before I get there, I want to just make kind of the claim that the fast food environments might be a particularly poor testing ground based on those guiding considerations I talked about at first. So if we think about issues of self-control and preferences, a lot of people going into fast food restaurants have clear preferences for the food they're going in to get. They already know that they plan to order certain things. I know when I go to McDonald's or Subway, it's often because I have a certain thing in mind that I want, right? I want a McFlurry, and so that's why I'm going to McDonald's, something like that. We also know from other past research that when you're making a decision of what to eat for immediate consumption, you have less self-control and you end up ordering higher calorie meals than when you're making a decision for delayed consumption. And so this idea that fast food environments are going to be one where you're going to get your food right away maybe is also leading to these unhealthier choices. convenience and price may be more salient concerns. And there's also some self-selection of consumers. I don't think very many of us, when we go to a fast food restaurant, expect to eat healthy. That's not like our overriding goal when we walk into a fast food restaurant. It's probably we chose to go to a fast food restaurant because our overriding goal right then was to get something fast, to get something cheap, to get something that I know what it's going to be. And so these might all be reasons why calorie labels on a menu aren't really going to change your decisions at the point of purchase. I already talked a little bit about current lack of information potentially being harmful or helpful. So if fast food restaurants have a really unhealthy brand image, giving them accurate information isn't necessarily going to change their decisions because they already expected it to be bad. Now you're just telling me that it's better than I expected it to be. And then, like I'm about to talk about going forward, is the information usable for all groups? Like I say, fast food restaurants are visited most frequently by low-income populations, so we really need to know whether there's a distinction between low and high-income people in their ability to use these labels. All right. So some past literature has shown that that low-income people are less likely to report seeing and using labels in fast food settings. And so we wanted to do a really different kind of study that looks at how good people are at noticing and using labels in what we call an incentivized task. I'll explain in just a sec. So what we did for this study is we had participants make a hypothetical order from a baseline menu, right? So I give you a menu, I say, tell me what you'd like to order for lunch if you were to look at this menu. And then I take the menu away and I give them a second menu. It's an edited menu where I say there's lots of changes on the second menu. What I want you to do is find as many changes as possible in the next 90 seconds. We tell them that for every change that they correctly identify, they'll get an additional entry into a lottery, so it's incentive compatible. There's a reason to try to find as many changes as you can, and there's 12 total differences on this menu. We recruited in a diverse neighborhood so that we're able to ask for self-reported household income, and we can split based on these income categories. So here's what it looks like, right? So it's very similar to a Subway or other sub-sandwich kind of menu. There's all these different options. So like I say, you're gonna first pick something that you wanna order. People were usually pretty quick about this, 30, 40 seconds to find what they wanted to order. And then, like I say, I give them that second menu and I say, now find the errors. You guys can kind of play along. Do you see any changes that were made since that first menu? What's that? Go ahead. Calories are different. We're paying attention to that. We're that group, right? That's going to really hit. Yep. So now it says 8 inches sub and rather than 6. That's different. Any others that people want to? Yeah, there's a picture missing. So yeah, these are the kinds of things that we're asking them to pick up on. So there's a bunch of different errors. This one is missing a description. We changed the logo slightly. The tuna sandwich now features a picture of a meatball sandwich. Things like that. But the thing that we really wanted to focus on, for every item on here, we cut the price and the calories in half. So on the first menu, it said that the meatball marinara cost $4.60 and it had 560 calories. Now it says $2.30, 280 calories. And like I say, that's for every item, including the sides and the drinks. We cut it in half. So we're hoping that's like a big enough change that you should be able to notice it if you care about these things, right? But if you don't care about prices or calories, you maybe won't notice that change. And so what we ask is just what changes did they identify? And sure enough, people are more likely to identify prices than calories. I don't think that's surprising. People are always thinking about prices when they're making eating decisions, purchasing decisions. So over 70% of our sample said that, yeah, the price looks different. You changed that price. Whereas it was only, what was it, like 65% of people noticed, oh, you changed the calories. This is fewer calories than it said previously. But then we wanted to split it based on income group and see if this pattern is different among the different income groups. And so we had these different bins of your income. And we found, sure enough, there's this nice big difference for low-income people. They're way more likely to notice prices than they are to notice calories. But when we look across the whole sample, we see that effect diminishes as your income grows, right? High-income people are more likely to notice calories than low-income people. This is a significant effect moving from this lowest income to this highest income for their ability to notice calories, right? So these low-income people aren't paying attention to calories as much as high-income people, which makes sense given these exceptions that I've talked about previously, right? Where we have high-income people being affected by calorie labels on menus. In case you're curious, there's also a difference by income group in terms of the hypothetical calories ordered. So in that first menu, we asked them what would you like to order, right? We can calculate the calorie content of what they said they'd like to order. And sure enough, we find that those lowest income people were ordering the most calories compared to the highest income people, potentially, again, reflecting they're not paying as much attention to the calorie labels. So some concluding thoughts. We ask, is the information usable? And we find in the research that I've had a chance to do and looking at some of these exceptions, this information does seem to be usable by our participants when they're making decisions online. And we also see from some of those other exceptions, other non-fast food settings seems to be a place where this information is usable. And then in this second study, this really different spot the errors, spot the changes study, we see that it's more likely to be used effectively by high income than low income groups. And that's really important. That's something to be paying attention to. So alternative formats, such as traffic light labels, might be providing the kind of prescriptive guidance that would facilitate use by groups unaffected by numeric labels. That'd be a next study that we'd be interested in doing, is if we were to test high versus low income people with traffic light labels or with other kinds of prescriptive guidance, would they notice those changes, even though they didn't notice numeric changes? That's something for us to test going forward. And in general, I just want to make this kind of this claim that I don't think tests can be restricted to fast food settings. If we wanted to evaluate calorie labeling as a policy, evaluating it only in fast food settings is going to lead us to potentially a biased interpretation of the effectiveness of calorie labels. And so to see where it can work and how well it can work, we really need to be testing it in multiple different settings, online, sit-down restaurants, healthier restaurants, unhealthier restaurants, testing it in multiple settings to see the shape of the effect that it might be able to have. So that's what I have for you today. I'd be happy to answer any questions or any other comments you might have. Thank you.